Hi, everyone. I'd like to welcome you to our panel, Spread the Health, a discussion on the COVID vaccine and healthcare mistrust in the Black community. I'm Allison Feaster, Vice President of Player Development and Organizational Growth for the Boston Celtics. I am also one of the many volunteers within the Celtics family, including investors, Celtics players, and staff working to drive Boston Celtics United, our organization's commitment to fighting racial injustice and social inequities in Black and Brown communities in Greater Boston. Our organization has always placed great value in using the Celtics brand to build a community. However, we immediately recognized the unique and urgent call to action upon witnessing the murder of George Floyd and upon listening to our players' call for a lasting commitment to impacting the injustices and inequities plaguing our community today. It was from those calls that on September 8th of 2020, the Celtics organization announced a $25 million commitment over the next 10 years to fighting racial injustice and social inequities in the following areas: equity in education, economic opportunity and empowerment, breaking down barriers and building bridges across communities, criminal justice and law enforcement reform, voting and civic engagement, and last but not least, it's a focus on equity in healthcare that brings this panel together today for a most important conversation around the COVID-19 vaccine and the healthcare mistrust pervading the Black community. Thank you to our distinguished speakers, and thank you to everyone else for joining this much needed conversation. I'll turn it over to you, Abby.
Thank you. As Allison mentioned, we're here to speak with the foremost experts, not only on COVID, but in healthcare in general, and to ask questions on behalf of the Black and Brown community. The goal here is to help inform everyone, but to inform especially those communities about their choices about the vaccine, and then not only to acknowledge, but also confront the mistrust in the healthcare system within the Black community, and we want to confront that head on. So I want to echo Allison's sentiments, and thank you all for being here. Just to let you know, Mackenzie and Cash have done a really good job of breaking this conversation up into 4 quarters. So you can stay with us. We're going to start with the historic and modern mistrust in the healthcare system, and then talk about the vaccine development and how it's been rolled out. We'll get into vaccine information, and then the 4th quarter will be left open for questions. So without further ado, let me welcome everyone and introduce you. First, we have Dr. Charles Anderson. Dr. Anderson is a longtime advocate of healthcare equity and the new president of the Dimmick Center in Roxbury, which provides care for over 19,000 people in the community annually. It's amazing work that they do. Dr. Joseph Betancourt. Dr. Betancourt is the Senior Vice President of Equity and Community Health at Mass General Hospital. You're also the founder of the Disparities Solution Center and a primary care physician. So a frontline worker, no doubt. We also have Max, who needs no introduction. Celtics legend, 2-time world champion, finals MVP. And yes, his number 31 hanging in the rafters at the Garden, Max. And we are also joined by 2 current Celtics, Grant Willams, a forward graduate of the University of Tennessee, and of course, fan favorite, everyone's favorite, Tacko Fall, Celtics center. So everyone, thank you so much for joining us. We want to start with the 1st quarter and talk about the history and modern mistrust that is within the healthcare system. And so Dr. Anderson, we want to start with you, because before we can talk too much about the COVID vaccine specifically, we want to go back. And there is a long-standing, valid mistrust of vaccines and the healthcare system in general among the Black and Brown community. So can you help us understand where that mistrust comes from?
Yeah, no, thank you. And I really appreciate the opportunity to participate here. And, the thing about the mistrust is that, when you think about the historical perspective, we all, or I should say many of us, have heard about things like the Tuskegee Experiment. And even though you hear about that, I think when you really take a moment and just realize this is something that started in 1932 and continued to 1972. And this was basically 623 Black men who had syphilis, who were denied treatment for that whole period of time, just so that the Public Health Service, the United States Public Health Service, could actually study the natural history of the disease. Now, during that time period, we had penicillin, we had treatment, but it was elected to not treat these men. And here's the thing about it. We hear those stories through our grandparents who, because they know of this and lived through that, tell us as we're growing up, you know what? You can't trust doctors. They're just going to experiment on you. Be careful. And when you hear enough of that, it echoes in your head for most of your life. And then things happen every day, which reinforce that. So we've got this historical perspective, which then gets transferred through our grandparents and through our parents and impacts the way that we view healthcare.
No question. And then you add in Henrietta Lacks. Can you tell us a little bit about that situation?
Yeah, absolutely. So Henrietta Lacks, actually, I went to Johns Hopkins for medical school, and this is where this all occurred. So Henrietta Lacks had cervical cancer, and she was being treated for her cervical cancer. She had fairly late stage cervical cancer, and they took cells without getting consent from her. And those cells actually are still utilized today. And there have been so many breakthroughs that come through the use of those cells. But the reality, this is another example of someone unwittingly and unwillingly participating in experimentation. And one thing I should add, interesting enough, when I was at Johns Hopkins Medical School, one of the things I found as I talked to people around the community, they would talk about these experiences that they grew up hearing, where people would sneak out of the scientists would sneak out of the hospital during the middle of the night, and they'd come into kids' rooms and they take the kids out, experiment on them, and put them back in the beds before the parents woke up. So here's the important thing to remember. These things, historical things, are things that are transmitted through stories, through families, and through generations, and become real.
I mean, it's appalling, everything that has occurred. Dr. Betancourt, knowing all of that and everything that Dr. Anderson just talked about, can the Black community trust that the current healthcare protocols and regulations that are in place now do and will prevent things like Tuskegee from happening again?
Yeah, thanks so much, Abby. And it's also an honor and a pleasure to be here and joining all of you. And I think, Charles and I have known each other for a lot of years, and I think we want to give information in ways that people can understand, and we do it with humility, but with a lot of passion and commitment, because this work for us isn't a hobby, it's our life's work. And the types of things that Charles was describing are beyond tragic, and they've happened in Black and brown communities. From Puerto Rico, there was experimentation on women in Puerto Rico, Guatemala. I mean, this experimentation issue is longstanding and has scarred communities of color as it relates to how they want to engage with the healthcare system, no doubt. I think what's a little bit different now is that as a result of a lot of those things, there have been a lot of protections put in place, a lot of kind of regulations and rules around how research can be done. And of course, we can't make any guarantees, and we're fighting this every day to make sure that healthcare is just and equitable. So that's part of our responsibility in the positions that we have the privilege to be in. But ultimately, I do believe that the science has gotten a lot better. We have the responsibility to be good stewards of that. And I'd say that the one thing as it relates to the vaccine, I understood more when communities of color were hesitant to participate in the clinical trials for the vaccines. And I got that because I think, to me, that connects with this idea of, experimentation, clinical trials. We're in a whole different ballgame right now, which is how do we address mistrust as it relates to just getting the vaccine itself? And that's a different conversation that we'll be having here tonight. But, I think I could understand mistrust even more around clinical trials. Now, look around and see who's running to get the vaccine, right? I mean, we have, people running to get it. It breaks my heart that this mistrust and this scarring will kind of prevent us, this kind of self-fulfilling prophecy, from stepping up and putting our arms up to get back to normal.
And if we don't cover that, please be sure to include it at the end if my questions don't get to that. And I think that that's a really good word is scarring. Those scars remain, and those are something that are not going away. Max, you can speak to that. You grew up in the South and grew up with these stories. And what are some of your experiences with the hesitancy and that you're hearing in people in their conversations? I guess more so just what is your experience growing up in the 60s and what have you observed and experienced in that mistrust?
Well, it's good you're saying I grew up in the 60s when I actually grew up in the 50s. part of the 50s.
Give me a little credit, yeah.
And I think one of the things I look at, and I hear what Dr. Anderson's talking about, but my mistrust goes back, you know, to when I grew up, and there were water fountains which had colored on it. There were white bathrooms. There were, you know, I went to a Myrtle Beach, South Carolina. We went to a beach there, and the beach literally called Atlantic Beach there had a fence which ran between from the top of the ocean, from the top of the beach all the way out in the ocean as long as the football field. And it was to keep blacks and whites separate, so blacks couldn't get into white water. But the thing I understand about this vaccine, and I think that a lot of people that I hear are hesitant, is one, because of the experimentation, but two, also because of the, I guess, saying it was sped up, that the vaccine, the way it was done, it's too fast. I mean, I'm going to be one of the first people that is, you know, once again, I'm 65 now, and I'm waiting. And I've actually started a group called Take the Shot. And it's an initiative right now to get several players and get people who look like me, and people of color, like a Liz Walker, who is a former anchor here in Boston, to take the shot, and actually for people who look and sound and feel and know me, that we can present this to people in our community. Because if we don't, of people of color, I heard a lady say that today, she said, if we don't do it, of people of color, we are committing genocide to our people. So I am looking forward. I talked to Tacko, I talked to Grant, and I am trying to get as many people as I can who have a face that can get in front of a camera and take this shot. And so other people of color can see and understand exactly what is going on and can say, he took the shot, I took the shot, and we're all going to get better for it.
Max, did you grow up with that mistrust of the healthcare system though? And did you hear stories like what Dr. Anderson was speaking? And how did you break away from that?
Well, I couldn't get into, we couldn't, there were black doctors and white doctors. You couldn't go to a white hospital. You had to go to a black hospital. So there was a mistrust in the black community already. So I understand what people are saying, but at this particular time, you look at the people as the doctor is saying, who are running to take this vaccine. If we don't have people of color, brown, whatever, to go take it, then we're not going to get well. Everybody has to be on the same page for everybody to get well and go forward.
Thank you, Max. Grant, your mom is literally a rocket scientist. I assume you grew up with science in your home. What were the conversations around healthcare like?
Well, especially my mom, she's been a person who's basically been a fighter most of her life. She just kind of always said that you kind of have to fight through things. And I think that was her way of saying that maybe not going to the hospital every time, because maybe there was a lack of trust or distrust or disconnect between the two. But definitely when it comes to healthcare, I have like relatives who work in the industry, and they say they see the mistreatment every day, and the perceptual, like they perceive people differently just because of how they walk in or how they're approached. And that's something that I think makes a lot of our community hesitant to go. However, we do have to understand that this is for the betterment of ourselves and for the future. The vaccine will allow us to go back to normal in life. And that's something that we all want and hope to achieve. So really taking the time to research, but I always encourage to do it, because it may not necessarily, quote, sound good or look good, because they say you make you feel good bad after a day or two, but looking towards the future is what I always say. Look towards the next step, and they'll see that it'll all work out in the end.
When you do have those conversations with your family and friends who you say work in the healthcare industry, what do they say? How do you make it better?
I think the biggest thing is just, as I said, continue to educate yourself and continue to really just put yourself in a position where now when you do walk in and people try to either throw big words at you or claim that they know more than you. You can at least respectfully disagree, but also say, maybe I want a second opinion and stuff of that nature. And that's something that I learned growing up. Is I remember I was misdiagnosed with a knee injury one time and went to see a second counsel, and turned out it was nothing at all of what they said. So that's why I say it's all about just one, educating yourself, not only about healthcare, but also about the vaccine, and then realizing taking the next step forward, because there's two options right now with Moderna and Pfizer, and making that decision is something that will have to happen.
You are your best advocate. And I would say even myself, it's not something I learned until I was an adult, that you could go and seek other opinions from other doctors. And
Right.
so I think that you're right. It's part of the education process. Tacko, you didn't come to the United States until you were a teenager, right? What have you experienced in your time here? And do you feel that same mistrust towards the healthcare system?
I couldn't say that I've experienced it firsthand, but I've heard about it. I've heard about it from friends. I've heard about it from people who are close to me. For example, with the vaccine, I know a lot of people who say that they are afraid to take the vaccine, or they're not going to take it at all. And even for me, just hearing all those voices, not being around here, I started to become a little, skeptical. And it's natural, it's human nature, where if you don't have a lot of information available to you, and those around you are skeptical about something, then it's all natural that you will do the same. And even like you say, coming from a different country and a different culture, in my culture, a lot of times people believe more using like traditional methods rather than having to go to the hospital, or having to use doctors, or having to use vaccine. For example, my grandmother, she has both hypertension, diabetes, and she only recently started using like going to the doctor and using pills and stuff. She always used traditional medicine, and it worked for her. That's something that we've done for ages, and something that we know about. So for me, it was different. And my mom, I remember we always used to get on her about going to the hospital, because she was always afraid to go to the hospital for some reason. So I grew up around that. So I understand, but at the same time, it's all about trust. I feel like if people trust you enough, then they will trust you because the human life is precious, and it's all about trust. So we just gotta find a way to convey that, like to have people trust in the healthcare system enough for them to be able to do that. But yeah, that's the reality of where I'm from.
Abby, can I ask one of the doctors a question?
Absolutely.
Here's a question I'd ask them is, so we're going to take this vaccine, and we're trying to get people who of color out there. How do you feel we should go? In what direction do you think we should go in trying to get people going to take this vaccination?
Like, what should the message be?
Yes.
Well, I think the message is, when we think about messaging, it's the messenger as well as the message. So I think one of the things that we didn't touch on with regards to trust is, I think you ask most people, and they're going to tell you they might have learned a little bit about the Tuskegee Experiment, but what they can tell you about is the everyday racial discrimination that they experience that constantly erodes any opportunity for developing trust. So I think one of the things we have to remember is that to deliver a message that's going to be received, we need to use trusted messengers. Right? I think there's definitely power in the fact that you have people who are saying, look, I want to hear from my doctors, preferably doctors who look like me. Right? I want to hear from my neighbors. I want to see how they did. Many of the people who said that they were not going to participate in the vaccine said, well, maybe I'll wait and see how other people do. Now, yes, there's been so many people who have already, but what they're really saying is, I want to see what happens to my neighbor. I want to see what happens to my auntie. I want to see what happens to my cousin, right? They want to see someone else that they know and that they can relate to who's had the experience. And I think that's just all about, when you think about delivering a message, it's got to be from a trusted source. And one of the things that we have a challenge with is that to really do this work, to really, really engage, do this work, we have to approach this in a way that's very different. And I think traditional approaches, which are, get someone on the television who doesn't look like them and say, this is what you need to do, trust me, doesn't work as well with things that require a degree of complexity like this does. And this is a complex decision. It was Operation Warp Speed. It came together really quickly. Did they skip any steps? I'm not sure. We'll probably get into some of that a little later. But these are all the things that go through people's head that make this a very challenging decision. And we have to acknowledge the fact that we need trusted sources in communities communicating with people from that community.
Well, Abby, isn't the internet maybe one of the worst things out here right now for taking the vaccine, because you hear so many doggone stories about it? I mean, over and over again, this and that and this, and people are trying to educate themselves, but they're getting information a lot of times from the internet, which isn't good.
And you can find likely sources to feed into whatever answer you're looking for. I couldn't agree more, Max. But Dr. Betancourt, do you feel like along these lines, the events of the last year with George Floyd and Breonna Taylor and Ahmaud Arbery, and just the division that we have experienced, do you think the timing of the vaccine, how quickly it was rushed, and then with such a clear divide in our country, is that contributing to some of the hesitancy?
Absolutely, and I just wanted to add on just the one thing that we were talking about in the last conversation, and then just jump into this. If we are going to engage our communities of color around the vaccine, we need to, number one, make sure that there's vaccine supply for them, right? Number two, make sure that they're aware that the vaccine exists, where it exists, and how to get it. Number three, we need to make sure that they could get it in an easy way, community-based sites, or facilitate them getting it, transportation and anything else that is going to facilitate them getting it. And I think, when we're doing this work on equity, we have to make sure that those baseline things are squared away as we chip away at the vaccine hesitancy. And yes, we are launching a whole trusted messenger initiative. We have about 140 doctors of color who are going to kind of be on the media, who are going to be in a van going community to community, that are going to be doing town halls like this, that are going to be creating videos, because as Charles said, that, the messenger is critical. And the truth of the matter is, a lot of the surveying showed that, I just don't want to get it first. And we're seeing that as we vaccinated our employees. We've actually seen where we started to where we are among our employees of color, because healthcare went first. We've seen a growth in the numbers among our minority employees. So, it's like a multi-legged stool, and we could do a lot of vaccine hesitancy, but if there's no vaccine in the community, then that's not going to get it done. And if people aren't aware of it, that's not going to get it done. And so a lot of people talk about this, what's happened in the last year and the rushing of this vaccine. And I'd say a couple of things. Number one, we've been vaccinating our kids and ourselves for a lot of years, and we've knocked out diseases with the vaccine. It's not foreign to us. I understand the mistrust, but I know that communities of color, are comfortable with getting their kids vaccinated because they care about their kids and their families. I'd say number two, vaccine science, just like all science, like the iPhone, how much it's evolved over the last 10 years. I mean, our science, our technology evolves incredibly. Now, the good news is that we were able to map this virus very, very carefully in like January to February of 2019. So scientists got working using a method that had been known, but that they were able to put together to really map out and create a vaccine for this virus and COVID. And it's not the virus. So I want people to be clear about that. And, you could say it was rushed. I would say that I would not recommend anyone to get the vaccine if I felt like I didn't look at the science and it wasn't good. And we looked at the science. Both of these vaccines, one had over 30,000 people, another had over 40,000 people. A lot of vaccines are approved with 5,000 people in the past, right? So the numbers are solid. The most diverse clinical trial participation in the history of this country. That's another thing that we can, I think, hang our hat on. And I'd say, third, people are worried about side effects. Our communities need to know they are not going first. And that may be comforting for them. We could give them information on allergies and side effects so that hopefully they won't feel like, okay, well, this is rushed and this is going to be tested on me. It's not. We want to get to the next step. And I'll end by saying that I'm trying to take some of the energy around racial justice and equity and say, hey man, don't get left behind. We fought too hard, right? Like we fought too hard this summer. to then not kind of get the vaccine and let this, again, this self-fulfilling prophecy happen where, again, there are these huge disparities. If we make sure that it's available to you, I want to just make sure, I'm not about twisting arms. I just want to make sure you have all the information you need to make the right decision for you. But man, we're going to try hard to get people information in ways that they understand, by people they trust, in ways that they feel comfortable, so we can get through this.
That does segue us to the second quarter and the vaccine development and rollout. You talked about the diversity of the trials and the fact, I think a lot of people, myself included, when you get the flu vaccine, they're injecting you with the flu. So what is different about the COVID vaccine? How does it work in your body? And what, just kind of go through the science of it for us.
It's incredible science, Abby. I mean, I think what we've done, the reason the flu shot takes a long time is because we have to anticipate what the viruses are going to be for the next flu season. We need to capture them. We grind them up. We take the surface proteins, what's on the top, and we grow them in eggs. And then those proteins basically get injected to our body. It's not live flu vaccine. It's not live virus. And then basically our body creates antibodies, is able to recognize those surface proteins, what's on the outside of those viruses. And so we're ready. We have soldiers that are ready to go when we get exposed. And I think the flu vaccine on a good year is 70% efficacy. These two vaccines now are upwards of 95% efficacy. So the science is different now. Instead of injecting you with kind of proteins off the top of the virus, what we are doing now is injecting into you a little messenger that makes your own cells spit out those proteins. And then your body makes antibodies to the proteins. So your own body becomes the engines. We don't need to grow this in eggs. Our body's own mechanism, this message, is able to create the proteins. They go away quickly, and the body's able to create antibodies. So it's phenomenal science. We're going to use it, in years to come, and people shouldn't be afraid of it. I mean, especially with the experience we have right now, we know that 90% of long-term side effects in vaccines happens in the first month. We're now several months into vaccination, and so I think this fear of long-term side effects. I think we could dispatch of that as well. So it's not a live virus. You need 2 doses because it gives you that. You need the second dose to get you full immunity. It's a new technology, but I believe it's one we could trust. And Charles and I have had the vaccine. My mom's had the vaccine as a healthcare worker. So, I think we stand behind this, and I think we could feel like it was studied, really well despite the speed.
Yes, Dr. Anderson, what was your experience receiving the vaccine, and then also just kind of the skepticism around it? Were there any steps skipped with the speed, and how were they able to get it approved so quickly?
You saying for myself or just in general? Did I have skepticism?
2 questions, I suppose. What was your experience getting the vaccine?
I mean, I think it is,
overall.
but I think it's also a good question and a very important question, because let's just be real. My mother grew up in the Deep South. Came to Buffalo, New York as one of the last stops because she knew family came through. There was one of the last stops on the Underground Railroad. We have a family that I was raised by that side of the family that we were really clear. You really, really have to be careful when it comes to dealing with doctors. That's probably why I became a doctor, because that way I'd know what they were talking about. I could help out, make sure we were going to be fine. But that was what I grew up with. Right. So despite being a doctor, public health, scientist, et cetera, and being very analytical, when I first looked at this, I needed to spend the time to understand it. I really, really did, because there was an element of me that was, I'm not sure. And when people asked me early on, I was very honest about the fact that I'm not sure. I need to learn something about this mRNA strategy. Right. I had to do my own work to get comfortable with it. And I did. And I think it's some of the things that Joe talked about, but there were simple things like knowing that the virus wasn't part of the vaccine was really important. So you're not giving me the virus, so I'm not going to get COVID. Great, fantastic. The other thing that was really important for me to understand is that this was messenger RNA. It wasn't going to alter the DNA of my body. It was a messenger that went into the cell produced the protein, the messenger went away, right? Great to know. I was concerned that my body would continue making this protein. No, once it makes that protein, it makes some of it, goes into the body, and it's done. Okay, that allowed me to feel more comfortable, because it was just like other vaccines. If you give me the protein and then my body makes antibodies, that makes perfectly good sense. And then a lot of the other things, I wasn't immune to looking at Facebook and that myself. And you hear all the crazy stories about microchips and other things, which I had to quickly dismiss. But I had to go through a process myself, right? I had to reach out to people and I had to really understand it, because I do think I came in with that same concern that many have, the same distrust that we talked about, which I think was amplified for many of us in 2020. 2020 was a tough year. 2020 was a year that we were reminded, seems like moment by moment of every day, about the mistreatment. And it's really hard when somebody mistreats you to then hear them say, trust you, and you just automatically do that. But I got over that. And 4 weeks ago, I had my first dose, and had sore arm for a couple days. Very similar to when I get the flu shot. I'm just one of those people. My arm gets sore for about 48 to 72 hours, and took a little Advil, and I was fine. And no other symptoms, no fever, no headache, nothing to it. It felt like any of the other immunizations that I had. Tomorrow I'll have my second.
You do. We'll see how your side effects go then. Although, right?
That's right. I'll have to come back and let you know.
That's what they say. Yeah, they say that it could be worse with that second.
What I am hearing is that the second time people say, it does, your body is going to react more to it, which is a good thing, right? That tells you that your body made antibodies and it's ready. It's getting revved up for this. So it's one of those things where when we do have those types of side effects, it reminds us that our body is responding appropriately. Things I have heard, people describe fever, some chills, not feeling well for 24 hours, and then they're back to work and they're fine. So I fully expect that. Maybe Joe's had his second, so he can tell you what happened to him.
I did.
Yeah,
I did. Yep, I had my second. I mean, and for both, the first one, a little sore arm, and I had a little bit of chills and a little low-grade temperature. Second one, it's kind of same thing, laid down on the couch for a couple hours. What we want to make people understand and help people understand is, the risk that you're comparing is a couple hours of not feeling great to COVID, which is really like Russian roulette, right? It's so that, we're a tough community, we're tough people, a couple of hours of, like Charles said, that's your body doing its work, right? You work out, you make a sweat, that's your body is doing what it needs to do. It's not debilitating at all. You have the protection, you have the confidence. And so, you might get things like the things we've heard are a little headache, low-grade temperature, little chills, little body ache. But, it's wild because when it hits you, kind of lays you out for a little bit. And then it's almost like, minute to minute, it's like gone. And so, and then it's behind you and then you feel good about where you are.
Yeah. And the other important point that you made, though, Joe, which is really critical, is the fact that what's the alternative, right? So in my mind, it was also that risk benefit. African-American male, 1.5 times more likely to be infected. African-American male, 4 times more likely to be hospitalized if I'm infected. 3 times more likely to die. I'll take a couple days of some discomfort to allow myself to be protected there. And also the other thing, and Joe, you might correct me if I'm wrong on this, but what I remember about this efficacy when we talk about vaccines and where we set these thresholds, what we're not looking at is the fact that in these trials, right, no one died after getting, and no one was hospitalized. So we set thresholds that are about if you're going to get sick, feel sick, but this other measure is that, well, no one died and no one got hospitalized. So that to me was really, really important in terms of this being very protective.
Yes. I mean, especially when you think about it in those terms, Russian roulette, Dr. Betancourt certainly makes it very serious. Tacko, you mentioned in conversations with others, there was some skepticism. What were you hearing?
Some of my friends here or some of the people that I've met and talked to about the vaccines, they very heavy on social media, like he just said, and they hear about the microchips and all the conspiracy theories. And me, myself, I would admit that I was kind of afraid, not on that side of it, but I just didn't know much about the vaccine. And the only thing that I knew is that whenever it's we talk about vaccine, they inject you with the virus itself. So like you said just now, it's not that they going to inject you with the virus. it's another process. So for me now, I can go back to my friends and explain to them like, okay, this is not something you have to worry about. They're not going to inject you with, COVID. You won't be fine, and just try to explain it to them. But I feel like it's going to take more than that to really convince people that it's completely safe.
Tacko, that's wonderful. I'm glad that we can do this and that hopefully this same message goes out to many more people. Max, what are you hearing? Because you are out there talking to people, trying to get the community on board.
Well, I think one of the things that I see is the not understanding education. And Grant said something really good about educating yourself. And then sometimes when you educate yourself, you do things which are wrong. I had two sons. Two of my sons both had COVID. And they both talked to me about it. And they said essentially, Dad, other than me not tasting and smelling things for about 2 or 3 days, it was like the common cold. But then I had a nephew who was their age, who was on death's doorstep and almost passed away from COVID. So you see all these different angles which come about. I had a guy on TV ask me, he said, well, a couple of Celtics have it. Do you think they should just go ahead and expose it to the rest of the team? I said, no, because you don't know how it's going to affect one person from the other. And I think that's the big thing that happens. And I'm like the doctors were saying now, it's always, most people of color right now seem to be saying the same thing. I'm gonna take it after my auntie takes it. Well, if you don't get sick, then I'll take it. I don't know what the alternative is, that you get COVID and you could possibly pass away. So I don't understand how people are looking at it, other than the fact of really having to take the shot. So that's what I've gotten from looking at my young men that I've had, my two boys, and then looking at the community in general.
And I think that's what makes Bill Russell and what he's done, and Kareem as well. I think that's really important for them. And Dr. Anderson, like you spoke about, and the message that you guys are working on and having doctors of color out there. The third quarter is vaccine information, although I feel like we touched on a lot of this. Either Dr. Anderson or Dr. Betancourt, when will the vaccine be widely available? And when do people need to start really making these decisions? And how, what are the plans to get the vaccine into communities of color?
Well, I would recommend that people start looking at it and thinking about it and asking those questions now. The reality, it's probably going to be April when we start seeing things open up for everyone. It's designed in phases. Right now, it's those who are 75 and older. It's getting to those who are then 65, and then there's listed by different vocations, et cetera. But I think generally, and this is being updated constantly, and so this might move around, but the latest thing on the website would suggest that by April, that's when it should open up to everybody.
Just to add to that, I think, different states are handling this in different ways. So in our state, in Massachusetts, as Charles said, we're doing this phasing, but other states are doing things differently, and that creates trouble for us, right? Because we hear, oh, my aunt in Florida got it, and she's rolled up to a CVS and all this other stuff, and we're saying, so that's a reality I think that we're trying to manage. But the other thing is, and I want to be clear for us in the state of Massachusetts, we really need to make sure that we're advocating. And this isn't just a Massachusetts thing. If you look around the country, there are maps popping up, and they are opposites of each other. The areas that COVID has hit hardest, and their communities of color, and areas where people are getting vaccinated, and they are the opposite, right? And I don't want us to just say, oh, that those people just don't want it. It's all about vaccine hesitancy. We have to advocate for equity in vaccine supply and location, and kind of how that's done in communities of color, because I don't want in our state and in others, for the narrative to be that, well, we're not going to rush it in communities of color because they're hesitant. To me, that's not equity. And I think we need to make it available and work on hesitancy. But yeah, it's going to be months, and I think people need to, be checking in on the information, and we'll be giving people information as well. But this is about advocacy, education, all these pieces all wrapped together.
And starting early, I think, and one thing I should be clear about, what I talked about was specifically for Massachusetts. You're absolutely right. You got to look by different states, and And also note that it's changing, right? That said, this is the time to advocate. The other thing I think you brought up, Joe, which is really, really important, and I've actually started changing our language, is not talking about in terms of hesitancy, but talking about in terms of confidence. Because the real issue here is that we've left a whole segment of our population with such a lack of confidence and trust, right? No, by no fault of their own or our own. And it's that distrust that's leading to these disparities or this differential access. So when you talk about the racial equity here, this is really about reckoning with that fact that we've created such distrust, such low levels of confidence that we are not able to make sure that everyone has the same information and has an even playing field from which to make this decision. Here's the really important thing about that. If we just say, okay, if that's not enough, right? And for me, that's enough. That's why I'm here. And that's why I do this work. But if you want to go a step further, we're already seeing that there are more variants being developed, coming out, right? There are more variants of this virus. And why is that? Because viruses, they do one thing. They get into cells and they replicate. The more they replicate, the more little changes happen. The more those changes happen, the variants that actually end up being more infectious are the ones that take over, right? The ones that get to the point where they can dodge the antibodies are going to be the ones that are going to be more prevalent because they're going to survive. As long as we continue to have this virus replicating anywhere in the United States, in any community, in any zip code, it makes it that much harder for any of us to get back to life as we knew it. So this is something that even if you can't get through the piece that's about it being equitable, right? At least understand that it's good epidemiology and good science to make sure that everybody gets vaccinated.
That is something when we talked about just the development. Well, is this a vaccine that we will have to get every year, like the flu shot?
What we have
Joseph.
on the table is two, right? And then we have a couple other ones that are being authorized now that'll be one shot. But with the variants, as Charles mentioned, we may need a booster. But look, again, vaccines, we do boosters, right? You get a tetanus shot, you got to get a tetanus shot every 10 years. We get a flu shot every year because they change. So again, not a foreign concept to us. And if we need a booster, we'll get a booster. And that it's part of this race that Charles is talking about. The sooner we are racing against these variants. The more we do around vaccination, the better we do there, the less chance they have to make things complicated for us in our hospitals and in our communities.
Grant, what conversations are you having, and are you hearing any skepticism about the vaccine? And do you have any hesitancy in taking it when it does become available?
Previously I had, before I had these discussions and heard these phenomenal people talk about the vaccine and the pros and cons. So when it comes out, that's something that I'm definitely trying to partake in and definitely get the vaccine. And another thing, the skepticism that I'm hearing are all the things you just said. How often will you have to take this vaccine? Is there enough information about what happened and how many people they tried it on and their side effects or the things that will happen in the future? And a lot of that we've discussed and said that it's been taken into account. And for us to really move forward and for us to really get better and be able to combat this virus, the vaccine is necessary. And I feel like something that not only just the Black and brown community should partake in, but everyone in the world just really use it as that tool to hopefully get us back to where we were able to see other people smile, other people laugh, and other people really show that expression and love to one another that maybe we haven't had in the past year and a half.
Grant, I do want to go back for you. Do you think, and do you feel as being a Black man that it has affected the fight for racial equality? Has that been something, and everything that you guys went through in the bubble and all of that, has that added to some of the mistrust when it comes to the handling of the vaccine?
Definitely. I feel like that's something that will always be used just because of the fact that it's happened in the past, and looking to past experiments or looking to how the communities, Black and brown communities, have been treated within the past 100, 200, 300 years. that's where the distrust comes from. But I always feel like we always are we say the bigger person in the means. However, it's kind of necessary in terms of we take that first step, and we can continue to be the genuine people that we are, and continue to really, really commit to something, and hopefully it comes back around in the end.
Okay, we can move on to the fourth quarter, and that is 4 questions. Before I open it up to Grant and Tacko and Max, Dr. Betancourt, can you just speak to one more time about the trials and just how this was the most diverse set of participants that has ever happened, and how did that happen, considering all of the fear and mistrust?
Again, we have had vaccines that have been approved with 5,000 participants, 3,000 participants, 7,000 participants. I think it's really important to put that in context. Now, the reason why such stringent kind of guidelines were put around the development of this virus and this vaccine, shall I say, is because it was going to move so fast. They say, okay, you're going to move fast, but you need to enroll a lot of people, and you need to meet certain thresholds of diversity that are unprecedented. And the good news is that both of those things occurred. And so we could feel confident that this is the single most tested vaccine in history, and the one that has had the most diverse clinical trial participation in our history. And I think in the past, clearly you say, well, is that going to work for me because it wasn't tested on people like me? We could dispel that notion. And we could say, well, was it tested on enough people? Absolutely. And now, I think most importantly for our communities, the bottom line is you are not first. You do not have to worry. We are past the trials. We are past you being first. At our system alone, we vaccinated over 70,000 people, less than 1% mild and moderate allergies. We talked about the side effects. So we have a lot of data. So now when I'm engaging communities around this discussion, I can say, look, not only are you not first, I got a lot of information for you. And let me introduce you to my colleague who's gotten it, and I got it. And so I think we got a lot more tools now that we can bring to our communities, given where we are in this place and time.
Thank you. That was something I wanted to make sure that we had out there. Yes, go ahead.
I wanted to ask you this. I wanted to ask the doctors this, and and this is one of those things. I want to be educated and want to get your opinions. Did COVID start with one person? And I wanted to get you guys' opinion because I keep hearing all these different things. What is your beliefs as doctors? How did COVID start? Did it go one person then multiplied, or how did it start?
It's hard to say. What you do know is that it started with one virus, right? So if you associate that one virus with one person or some other vector, but it started with one virus that then replicated, and that's what happened. So at some point it was present in one organism, right? That's all we can say for sure. But there's a lot of work going on right now to try to figure that out. There's been a lot of theories about whether or not it started in animals, in bats, for example, instead of in humans. And we've seen viruses that originate that way also. But it had to get from that it had to get to a person at some point, though, to your point.
And the history of pandemics is exactly that. It's oftentimes animal to human transmission, whether it be SARS, whether it be H1N1, there's a whole long list of these pandemics that have, transmission, these viruses mutate and they jump. And so, this is not unlike things that we've seen in our past. And it's been, as devastating as any we've seen, though.
Grant, Tacko, do you guys have any questions for the doctors?
A lot of the questions that I had, Max has been on top of, honestly. Max, all the things I was thinking of, whether it was in terms of the vaccine's origin or just in terms of how many people were in the clinical trials, like all those things have been answered, and they've done a great job of expressing and hopefully growing my knowledge.
I think I still have the antibodies for COVID because we got tested for it. So is it necessary for someone like me to still take the vaccine?
The recommendation is that it is still necessary. And part of it, we do not know how long those natural antibodies last. So that's really important. The other thing that we don't know is, let's say you had it back in April. Let's see now we have a variant that's slightly different than what your antibodies were exposed to then, right? You're now potentially getting something that can be of benefit with this new variant, right? But the bigger question is, we don't understand yet how long those natural antibodies are going to last, and you don't want to take that risk. And there have been people who've had COVID more than once.
Bottom line too on the what we know about antibodies is you could test positive for antibodies. That's really not saying how effective they are. So that's one. Second is we have seen that people who've gotten sicker have, you know, more antibodies and maybe better antibodies than people who've had, you know, less illness. We know that. But the nice thing about the vaccine is the vaccine provides a complete portfolio of those proteins on the virus that your own body may have kind of picked up some. This should give you a complement that gives you a lot stronger immunity. And so for all those reasons, and it's a great question, especially for communities of color, because, you know, it hit us so hard for people to say, well, if I had it, should I get it? And the answer is yes, absolutely.
Grant, for you too, I feel like, you know, you guys are 21, 22 years old. You feel invincible, that nothing, I mean, you look at Marcus Smart and he had no symptoms at all. Is there a way to, I don't know, how do you communicate that this is something real, the Russian roulette situation? Like, how do you make that clear? Is it just from seeing people go through it, or how do you kind of break through that feeling of invincibility?
Partly is experience. When you look at our community, our age demographic, really, we judge a lot of things based off of how it is around us, whether or not this person had it, whether or not this person is going through it, like what they tell us, rather than trusting the people above us. We're kind of rebellious in that nature. But in all honesty, like,
Thanks.
Sure, you may not necessarily get symptoms, or you may not say it's going to affect you. But what if you give it to a roommate or a brother or a little sister or your cousin or grandparent? What even if you do get it, and next thing you know, you do get that one bullet in the gun of Russian roulette, and you're on death's bed, and you're thinking, maybe I could have stopped this just by getting a simple shot and vaccine. So that's something where I always say, I don't want to be that person where my career is over because of the fact that I didn't necessarily take the steps to prevent and protect myself. I don't want to be that person that drops the ball for those around me, whether it's my grandparents, my brother, or my sister, and gives them something in which they have either a breathing problem or heart issue afterwards. I don't want to be that person. So not only thinking about my own health, but about the people and the people around me. I've said I want to protect them as much as I do myself.
That is going to be the biggest challenge, though. You know, when you looked at the early surveys, it was very clear that these Gen Z, younger group, are the ones who are less interested in this and want to wait and see how other people do. And I think that is that sense of being invincible and all the things that you mentioned. So I think this is an area where there's going to require a tremendous amount of support by young players like yourself, who are able to be very clear. Yes, I'm healthy. Yes, I had it, and I seem to do okay. But you know what? Just like you described, do you want to play Russian roulette like that? You never know what's going to happen. And there are a lot of people who, unfortunately, are having, even though they had asymptomatic exposure to this, they've gone on to still, they're a little foggy in the way they think, or just all these little things that aren't quite right. So it's still the sort of thing where you want to A, try to avoid it, and B, if you are going to be in contact with it, make sure your body's prepared to fight it.
I mean, that's a great point. This virus is unpredictable. And I'll tell you, I've seen, like Mr. Maxwell said, I've seen, 20, 30-year-old people in the hospital, right? So the unpredictability should make young people concerned. And I think the second is, if you love your family, you don't want to be the one that gives somebody in your family COVID, right? Like, so if you care about your mom, your dad, your family, and this idea, well, if I don't get it, you can still give it. And it's not something you want to give, and that's not something you want to have in your conscience, going forward in life.
Yeah, and just be clear about that, Joe. You might be able to speak to this, because the studies didn't necessarily look at whether or not you would be less likely to transmit it to somebody else. But what we do know about virology is this: if you have antibodies, the amount of virus that you have is going to be lower, right? That's the whole point. You're going to stop it before it replicates and has too much viral load in your body the more viral load you have in your body, the more likely it is that you're going to be able to transmit it to someone else. So you might hear people say, well, it wasn't studied, it's not sure, but it is good logic. It's probably a pretty good bet to make that if I have fewer viruses around my body because I took this vaccine, that I'm less likely to give this to someone else.
As Grant mentioned, I think a huge part of this is education and communication. What are some trusted sources that people can go to find accurate information?
I mean, the CDC website has some really good information there. I think that's a great place to start. I will tell you our at the demic.org, we've got information there. There's been a lot of great information by our academic medical centers like Mass General, which Joe can speak to. I mean, we're in a great place here in Massachusetts in that we've got just amazing healthcare resources and very trusted resources by those of us in the medical community. So I can say if I go to those and look at those and feel good about the information, just like I did to try to get comfortable, those are places that I went. Those are places that I recommend to others as well.
Thank you all so much for taking
Thank you.
much time and being a part of this conversation. And I just have to say that for more information, we do invite everyone to visit the COVID Vaccine Information Hub.
Thanks, Abby.
Thank you.
Thank you.
Thank you.
Everybody.